Good morning to all. A very warm welcome. Today is the third in the series, the third week of our therapeutic diet talk, and this time we are talking about the role of obesity, and uh, and this is. I hope this weekend we'll have a happy learning. The first speaker is Dr. Satyendra Khichar. He's the assistant professor here at AIIMS Jodhpur. He is from the Department of Medicine. He will be speaking on the role of nutrition in obesity or overweight. Dr. Satyendra is an MBBS from Dr. S.N. Medical College, Jodhpur, and he's an MD from Sardar Patel Medical College, Bikaner. Currently, he's working as assistant professor at AIIMS Jodhpur, and he's written a research paper on serum uric acid as a determinant of metabolic syndrome, nominated for M.J. Shah Memorial Award. Sir, we welcome you.
Change the slide. Honesty का सकते हैं?
हाँ सर प्लीज
I will change formats.
हाँ जी सर मैं भी कर रहा हूँ
Kiss button. Can I start? No?
Yes.
Hello, good morning, everyone. Role of nutrition is very much in obesity, and we will discuss today. Although it is very controversial that what diet is ideal, but we will enlighten today the literature and research. First, formally knowing what is obesity. So there may be first visual impression, we can assess that someone is looking obese or not. Second, like that if weight is more than height. So the universal marker which we use for the assessment of the obesity is BMI, that is the body mass index, and the WHO classification of obesity, if BMI is more than 25, then we call it as overweight or obese, that is the excessive weight. But problem with Indians is that Indians are having thin body which is having much of the fat. Like in this diagram, that is the paradox, we can see that two persons BMI is equal, but fat content is more in the right sided person. So the Indian person has more fat in the body while they are looking thin. No slides are visible.
Dr. Satyendar, we are not able to hear your voice and even slides are also not visible.
बदाम काजू जे आहे ना ते संध्याकाळी आणि खजूर आणि मनुका जे आहे ते ह्यावेळेस दुपारच्या वेळेस चालतो. ते फळांमध्ये मोडतं ना.
Sorry to interrupt you, sir, but I think most of us cannot see the slides or we cannot hear anything. Okay, okay, sir. Okay.
Sorry for keeping you waiting. There was a technical error. I request Dr. Satendra to please resume the session.
So good morning. Thanks for your patience. We will start the role of nutrition in obesity. So very first, we will introduce what is obesity, a formal introduction. Obesity can be assessed by many modes. First, like visuals, we can see that any person is looking obese. Second, if weight is more than height, or the universal marker for the obesity is BMI, that is the mass index. So according to WHO classification, if the BMI is more than 25, then this weight is considered as pathological. So there are various classes, but more than 25 is considered as pathological weight or obesity. But problem with the Indians is that, or we can say that Southeast Asians is that they are having lean body, but that is containing excessive fat. So we can see in this picture, there are two persons, but BMI is equal, but body fat is different. So there should be some another landmark of the BMI for the Southeast Asians or Indians, and that is for the Indians accepted by WHO. If more than 23 is the BMI, then the weight should be considered as pathological. And another marker for the obesity is the waist circumference, and that is the marker of centripetal obesity, that is more pathological type of obesity. And cutoff value for the Indians and South Asians is 90 centimeter for the male and more than 80 or equal to 80 centimeter for the females. So that is different from the Americans and Europeans. So after evolution, we know that worldwide trend in the BMI or the weight, there is the increasing in the weight while decreasing in the undernutrition, and India is also following the same trends. Like in this picture or diagram, we can see that undernutrition is gradually decreasing, but overnutrition, obesity is increasing in the India, in the developing countries, as well as in the developed countries. So we know that evolution of human being is accompanied by the evolution of lifestyle, evolution of the diet, and evolution of the diseases. As we know that our ancestors were in the jungles, their lifestyle was different, their eating behavior was entirely different from the now. They were in the jungles, the main diet of their containing the vegetables and fruits. Like we can say that these are the various type of vegetables, and per 100 gram calories are very low. Except potato, all other like gourd, brinjal, bhindi, all are having less calories per 100 gram. So they can consume more volume and that will provide less calories. Along with fruits, we can see that per 100 gram calories are very, very much less. So their dietary contents were containing more volume and less calories. And that is the for non-vegetarians, they are also having less calories per 100 gram. Then we evolved out of the jungles, the life were settled in the villages, but there were, along with increased physical activity, the diets were containing like cereals, legumes, and we can say that calories per 100 gram has been increased. We can say that wheat per 100 gram chapati is containing 243 calories, while rice, if it is starch removed, it is 111 calories per 100 gram. Legumes, that is the protein containing high calories. These are important dietary content of the villagers. And that is when we added oil to increase the taste of food, that also provided increased calories. So we can say that with evolution, our calorie content per 100 gram increased. And the modern lifestyle, when there is very, very less physical activity, sedentary lifestyle, and the dietary content are containing very dense calories. So what is wrong with modern diet? If we can say that our physical activity is very, very less. So modern living with limited physical activity actually does not required amount of food we eat. And most importantly, the food which we eat is refined, rich in calorie, rich in fat, Now we are consuming food like that is very, very dense in calories, and that is not required. And that is the pathology in the diet, which is causing the evolution in the diseases, evolution of the obesity, and now the obesity is a epidemics worldwide. Like in Jodhpur, we are eating kachori, samosa, mathdi, papdi chaat. Every diet is containing much calories per 100 gram. And along with this diet, many persons which are consuming alcohol, but they are not counting it as a food or not counting as a calorie. So they are consuming calorie but not counting. So that is also contributing to the obesity. And finally, to increase the taste, we are destroying our healthy foods. We can see that steamed rice, which is healthy, and we convert into fried rice. Bread is converted into cakes. Simple roti is converted into paratha, butter naan, puri. Potatoes converted into French fries. Fresh green salad, which is very healthy. And if we convert into salad with mayonnaise, steamed vegetable, if we fry them, dal converted into dal makhni, fried fish, grilled chicken converted into butter chicken. So that all healthy food is converted into unhealthy food to increase the taste. So that is very important. We are developing unhealthy habits of eating, and that is causing the obesity. Like we can say that early times of 20th century, the main cause of death were tuberculosis, that is infection, followed by heart disease. But in 1950s, trend changed and the heart disease topped the list. And finally, it was accepted in 90s that diet heart hypothesis, that eating too much dietary saturated fat and cholesterol is responsible for increase the heart disease. So there is direct connection of the disease and diet. So how to intervene? What we can do? That is very important. That body mass is a directly relation to the energy intake and energy expenditure. What we intake and what we expenditure is balanced into the body mass. So we should intake as low energy as possible and expenditure as much as energy possible. Energy intake is by diet and energy expenditure is by physical activity. So we can say that to decrease the body mass, we should decrease the calorie density and increase the physical activity. And these two activities, we can say that synergistically decrease the weight of the body. Like on the enlightening on the diet, first in the documented in the literature is in 1863, William Benting documented his weight loss over a 1 year by the low carbohydrate diet prescribed by his physician William Harvey. So first he documented that decrease in the calorie intake led to weight loss. Followed by Norden, that he suggested that reduced calorie diet by reducing the fat can lead to weight loss. In 1972, Atkins introduced very little carbohydrate diet containing diet, and that can lead to weight loss. So there were ample suggestions about, some were saying that fat should be less, some were saying that carbohydrates should be less. And end of the 19th century, both low carbohydrate diet as well as low fat diet has entered in the realm of the medical prescribed program for the patient with obesity. ADA also have evolved on the diet, but there is no much change in the macronutrient constituents of the diet. Like we can say that in 1994, ADA suggested total carbohydrate 55 to 60%, protein 12 to 20%, total fat less than 30%. In 2008, that is near equal of the 1994. Nothing much has changed. So we can say that by various studies, it is obvious that low carbohydrate diet can lead to weight loss in earlier months, but by this study we can say that at the 3 months weight loss by low carbohydrate diet is much more than low fat diet, but at the end of 12 months these are both equal. So weight loss is equal in low fat diet as well as in low carbohydrate. So it is not a matter of debate that which things should be low. Ultimately, calorie consumption should be low, or the food which are containing dense energy should be low. Like in this, there are various formation of diet or various constituents of diet, like 65% carbohydrate, 15% protein and 20% fat, Second diet 55% carbohydrate, 25% protein and 20% fat. Each constituent ultimately is having initial weight loss followed by equal weight loss over 2 months. So that is not much of important that what should be the constituent of diet. Important is that energy density content should be low, and if we consume low energy density contents, then we can increase the volume, we can increase the satiety, we can increase the variety. Like comparison of weight loss diet with different composition of fat, protein and carbohydrate. This article concluded that reduced calorie diet resulted in clinically meaningful weight loss regardless of the macronutrient containing. And important, like we studied that weight loss is equal in all type of diets, but in figure A, we can say persons who count more persons more sessions for the counseling for the diet actually lead to more weight loss and they continued the losing weight. So adherence to a particular diet is important and that is increased by the counseling. So dietary consuming low energy with adherence to a particular diet is important. And most important is humans do not consume nutrients, but they consume a mixture of food. And we have to provide a variety, that no single ideal dietary distribution is important, but the dietary distribution should be individualized and keeping total calorie and metabolic goals in the mind. And that was recommended by the ADA from 14 to 19. So what is healthy food? Healthy food is that can address personal and cultural preference of the person, willingness to adhere to that diet of person. Second, that should be practical for that person to consume that diet. And last is to maintain the satiety and pleasure of eating. If we provide such healthy diet to any person, it is possible that he will consume that diet for a long time and that will maintain or lose his weight. Like in this diagram, we can say that we are increasing the volume of diet. Raisins are containing high calorie, high energy density, so they can be consumed in low amount, while we are seeing that apple can be consumed in high volume because calorie density is lower than raisins. So we can provide a variety. If energy density of food is the low, volume can be increased, satiety can be increased. Like in these 3 plates, first plate is containing high energy, 800 kilocalorie. If we decrease the calorie, then the amount will be decreased, but same calorie can be provided with greater amount if we increase the portion of vegetables and fruits in our diet. So that is much more important concept, that there are diversity of diets, very low energy diet, low energy density, medium energy density, and high energy density. So in this table, we should prefer to provide very low energy density diet to the person and decrease the high energy density like chips, cookies, nuts, butter, oil. These should be decreased in the diet, while fruit and vegetables should be in ample amount in the diet. So that will provide variety as well as volume. So ultimately fat should be low, protein should be 10 to 35%. So it can provide the satiety, carbohydrate 45 to 65%, fiber should be increased. It will increase the satiety as well as it will decrease the energy consumption. So the model plate, we can say that most of the model plate or 50% of the model plate should contain fruit and vegetable along with dairy products and cereals and proteins. So that is the model plate. And in the Indian eating, we can provide a model plate like veg and non-veg, wheat-based, like Northern India, wheat-based diet is important. So 3 chapatis along with vegetables, salad, and this curd is providing approximately 500. Vegetarian 2 katoris of vegetable along with 1 katori of salad, 1 katori of curd, and 3 chapatis, that is providing approximately 500 calories. In rice-based, like in South India, we can advise a model plate containing half of the part with vegetables and half of the part with cereals, 1/4 with cereals and 1/4 with the protein. And that is with vegetarian, 1 katori of dal along with 1 katori of vegetable, curd and salad along with rice. So that is the model plate. In this plate, we can see that most of the part is full by vegetable and fruits and salad. So that is the ideal. It can provide variety, volume, or pleasure of eating to the person. So important is first to initiate the weight loss, but initiate weight loss is important, but more important is to maintain the weight loss, and that can be maintained if first person weight monthly, keeping a diary, so that he can see himself that he is, when he is eating non-healthy diet, avoid in between eating. Indian is habit is that in between eating we do not count the calories, but these calories are counted by the body. So in between eating should be avoided. Avoid carbohydrate and fat rich food. Reverse eating, that is very, very much important, as in the initial part of the eating we should consume, like in Indian diet we consume chach and dahi in the last of the eating, but we should consume like chach, salad, dahi in the initial part of the eating, and energy density food in the last part of the eating, and that is an important strategy to reduce the weight. Eat lot of vegetables and fruits, be consistent with your diet, and yes, pleasure eating, like what we like, we can consume that, but that should be restricted to 2 to 3 days a month. And if we eat others people's food or food from others plate, that calories counted by the body. So that is very, very important. Some of the misconception that rice should not be taken, mixing atta and chana, as we have seen that atta and chana are having equal calories per gram, so mixing will not reduce the calories. Fruits are not banned. We can consume the fruits. Important is the energy density. Honey can be taken in plenty. Honey is containing sugar, so it cannot be taken in the plenty. Potato is banned. Potato is not banned, but in carbohydrate, it is having high energy density, so it should be consumed in low amount. Bitter fruits nullify sugar in the blood, and overeating on one day can be compensated by total fast next day. These are misconception and hindrance in the maintaining the weight loss. So concluding my presentation, that healthy eating pattern include a variety of nutrient dense foods, limit portions of energy dense food, consume energy dense food as low as possible to reduce the overall energy density. A number of dietary patterns that reduce energy intake in relation to energy expenditure lead to similar weight loss, so that doesn't matter. And a unified factor for weight loss across dietary pattern is energy density. Reducing diet's energy density allows individual to consume satisfying amount of food for fewer calories. Thank you.
Thank you, Dr. Satyendra. It was a very insightful and knowledgeable session. You covered almost, the importance of nutrition in combating, I would say, overnutrition or overweight, and controlling obesity or controlling weight management. You talked about portion size, importance of the BMI in terms of Asian per se, and the ideal plate concept also you covered, and the most important part you gave important the important tips on how to control the weight, and you cleared some of the misconceptions. Thank you so much, sir. Now moving forward, I would now invite dietitian Ms. B. Harita Shyam. She is the Chief Clinical Dietitian of Apollo Hospital at Hyderabad, Telangana. She has over of more than 19 years of experience in the field of clinical dietetics. And she's been instrumental in planning, initiating of nutrition care process in hospital, and creating and implementing critical care nutrition protocols and policies. She's been handling nutrition requirements for different therapeutic, diets for renal, cardiac, diabetes management, organ transplantation, etc. And she's been a faculty in various universities wherein she teaches PG diploma in nutrition and dietetics in Medvarsity. She's taking a fellowship in nutrition and also taking a she's a faculty in PG diploma preventive and promotive healthcare. She is also author of the Enteral Nutrition Formula, Critical Care Nutrition, which is published by Indian Society of Clinical Care Medicine, Pune chapter. Thank you so much, ma'am, for accepting our invitation, and
Thank you.
we look forward for your insightful and educative talk. Thank you.
Yeah. Can I share my slides? Have you allowed slide sharing?
Sure, ma'am.
Let me give it a try once again. Dr. Rashmi, you can see my slides.
No,
You had successfully shared the slides, but then you stopped.
Now?
No, ma'am. Not yet visible. Can you please share it again? Yes, ma'am.
Yes.
All the slides are visible.
Okay. So I can start, right? Hello? Can I go ahead?
ma'am, you may please begin.
Yeah, okay. Thank you, Dr. Rashmi, and the entire team of Public Health from AIIMS Jodhpur for having me on your session. At the outset, I'd like to thank you all and congratulate Dr. Satyender for a very easy flowing and beautiful presentation, right from obesity evolution to actual practical tips and current guidelines. So I will be a little in detail about the current guidelines, which are given by reputed organizations and associations, and delve into my experience of dealing with obesity management on a day-to-day basis. Doctor has already covered what is the difference between being overweight and obese. A BMI between 25 to 20, between 25 and 30 is overweight, and anything above that gets categorized as class 1, class 2, class 3 obesity, and there all the challenges of metabolic derangements also begin. However, for Indians, the BMI cutoffs could be as low as 23, and it is very, very challenging in real life situations to try and achieve a BMI of 23. So therefore, if one is already overweight or obese, though they should have an idea about what their ideal weight should be, it may not be always very practical to come to a very idealistic BMI, especially something as low as 23. So, if you look at the prevalence of obesity, Sir has shown the trends. If you look at the morbid obesity in our country, it's at about 5%. However, if you look at prevalence of the entire range of obesity from class 1 to morbid obesity, it could range anywhere between 3 to 15%. In addition to that, with a BMI of 25 to 30, there overweight category is another whooping 25%. So if you put all of this together, from 25% of overweight to another 10-15% of being obese to another 5% being super obese, we could have a range of about 30 to 40% of the population which is trying to deal with obesity. And we, as we all know, each one of us is battling with the burden of obesity. This is an Indian map which is showing prevalence of obesity, the difference between what it was in 1990 and what it is currently in the 20th century. We will see that the prevalence was less than 9%, and therefore the entire Indian map was covered with the blue color. But if you look at the prevalence now, it is greater than 24%. In many pockets of India, and therefore we cannot run away from the dual burden of both malnutrition as well as overnutrition. And this is not limited to adults. We see that it is so very much prevalent in younger children, and we've seen it more closely, more acutely, and more quickly in this pandemic period, where children have gained anywhere between 6 to 10 kgs of weight, and many of our consultations are now as young as 11-year-olds gaining weight. So, as Dr. Satyendra rightly pointed out, it is a clear difference between the energy intake and the energy expenditure, and the imbalance, which was very, very clearly seen in this pandemic period. We saw that people could have gone for walks or done some activity in the house. That did not happen. People got holed in the four walls, and therefore did not, on one side, do any physical activity because we were very confused about what we had to do. On the other hand, there was a lot of experimental cooking because the entire family was at home. Excess calorie expenditure or excess calorie intake, could lead to a lot of fat storage, because carbohydrates are simple. Carbohydrates are not stored in the body, and they get converted to body fat stores. So what are the methods of dealing with obesity? The doctor pointed out many ways in which or reasons why obesity occurs, but how do we deal with it on a day-to-day basis? So if I had to put it in 10 major points as to how do we deal with obesity, the 10 steps to deal with obesity or overweight. First, of course, is measuring your height, weight, and arriving at a BMI. Second, certainly would be measuring waist circumferences, because about 90 for men and about 80 for Indian women would put them into central obesity, which could be one of the major indicators of metabolic ill health. And how should your patient be treated? That is something that we need to focus on based on BMI and based on their comorbidities. So usually the difference would be if they are metabolically fit but fall into the overweight or obese category, we could still deal with them in terms of lifestyle management. But at a younger BMI or at a smaller BMI, they have huge metabolic derangements. Then we could look at alternatives of pharmacotherapy or sometimes even surgical intervention. The fifth point or fifth step to look into would be is your patient ready or motivated? Because a lot of time in the clinic, you will see a patient walking into your clinic very hesitantly, only because the doctor has referred, or maybe because the family insisted that they need to lose weight and drag the patient to the clinic. In such scenario, if the patient is not motivated, you cannot do anything much in the long term. And more than the physician's involvement or the dietitian's involvement, it is the patient involvement which is so very crucial for the success of long-term weight loss. What diet should you recommend? We will look at this in detail, but at the gist of what Dr. Satyendra said is absolutely correct, that you're looking at total calorie reduction or total energy reduction, whichever the carbohydrate or whichever macronutrient you want to reduce. Of course, we need to, step 7 would be to discuss physical activity goals, because without discussing physical activity goals, you will not be able to give that kind of a thrust to weight loss that you need to see. With the earlier ancestral population definitely doing a lot of physical activity, comparatively our physical activity is a negativity. So whether we are looking at generally being fit, whether we are looking at being metabolically fit, looking at aging in a healthy manner, or looking at weight reduction, we need to have some kind of physical activity, at least an hour a day, uh, from the entire 24 hours. Which kind of physical activity will really depend upon the patient, and therefore we need to take a detailed history about what they're into, what their likes and dislikes are, what is it that they are already doing, are they underdoing something, they're overdoing something. A detailed history really helps to correct the kind of physical activity that they are doing. Point 8 would be to have a weekly record of the intake that they are doing, both physical activity and food intake. It may not be a physical handwritten record. These days, we get a lot of online records which give you graphical representation, bar graphs, line graphs, to tell us exactly how the intake is going based on the metabolic rate or the BMR that we have calculated. We need to give them a lot of material to read. Yes, that helps, and guide them so that they can look at it at leisure time. And this is pretty much entering patient information in a safe record or an electronic record helps us review the patient details when they come. Now, coming to diet therapy, in majority of the overweight or obese patients, adjustment of the diet definitely will require to reduce the overall calorie intake. How much calories to reduce? About 500 to 1000 calories per day. You need to look at reduction. That means we may not even go up to 1000, because most people would have already reduced, or if they are at a very high of 2500, 3000 calorie intake, suddenly cutting down 1000 calories may not be even acceptable to the patient. So in a way, you can say that beginning with cutting down of 500 calories per day is something that you can look at, especially if you need to step down the patient from a very high of 2500 to 3000 calories per day. Then coming to the low calorie diets. So in a debate between whether it should be a low carbohydrate diet or a low fat diet, at the end of it, it is the total energy which is important and relevant, and therefore we need to cut down either of them based on the assessment or detailed dietary intake of the patient. One of the first steps to determine, or which would give you a kind of a jump start to start deciding what kind of an intervention that you would want to do, entirely depends upon what kind of a actual intake currently the patient is having, and therefore assessment of dietary intake will lead to tell us whether it is a carbohydrate dense diet that the patient is having, or a fat dense diet that the individual is consuming. Either way, calorie density is quite high in carbohydrates, quite high in fats, and based on that, we would determine what kind of a dietary implementation we want the patient to do. Now, when it comes to VLCDs, which are very low calorie diets, we are seeing a surge of this in the on the Google, on the internet. If you just put this up and look at various diets that are prevalent, one of the major things that does come out are the very low calorie diets, especially the very low carbohydrate diets and the high protein and the high fat diets. Now, if you compare the impact of this, with weight loss, you will see that most of them have immediate weight loss. That means you would see a quick weight loss, but if you look at the same patient and follow up the same patient over a period of time, there would be significant amount of weight gain. And at the end of 1 year, weight loss with low calorie diets versus very low carbohydrate diets are quite similar. So what is it that we are implying? Research as recent as published as recently in BMJ in 2020, in this year 2020, has shown a difference between total energy restriction and intermittent fasting. Intermittent fasting is a very big thing now on the internet, but all of that gives you more immediate short-term results. But over a period of time, when the individual is not able to sustain that kind of a dietary intake, you will see that the results at the end of 1 year with low calorie diets versus any of the fat diets is quite similar. So to maintain the pleasure of eating, to maintain the balance of nutrient, to do the weight loss in a very medically correct manner, it would be ideal for you to prescribe very low calorie diets. Ideal for you to prescribe low calorie diets. Now, is it appropriate to prescribe medically appropriate to prescribe very low calorie diets? In certain situations, yes. So it should not be a blanket rule. It should not be the first line of therapy. But you could get individuals who are about 60, who are wheelchair bound, or who need to go in for a TKR, or who are so obese that they cannot go in for any kind of a surgery. These are the people who could be given low carbohydrate or very low calorie diets of about less than 1,000 or 800 calories with meal replacements. In meal replacements, you still have the right balance of carbohydrates and proteins with additional vitamins and minerals. And you could use either a 1 meal replacement or 2 meal replacements to achieve the kind of weight loss, either in certain pre-surgical conditions like TKR, or in certain situations where the person is actually a right candidate for a metabolic surgery or a bariatric surgery, however, cannot undergo surgery for various other medical complications. In such situations, the only solution would be to use a meal replacement. And even though they are very low calorie diets, for that individual with the medical background that they have, they would be more appropriate to use. So if you look at the overall nutritional management, it has to have a holistic approach where you do a detailed nutritional assessment, especially of the nutrient intake and the type of macronutrient where the energy density is coming from. You devise a clear intervention strategy, discuss it very clearly with the patient, and have him accept the kind of diet pattern that we are prescribing. Establish very, very realistic goals. This is so important that sometimes talking to them about idealistic BMIs could be very, very overwhelming. And therefore, when you're meeting them initially, give them small goals and ask them to come back and tell them that it's sometimes not it's sometimes okay not to be able to reach the very idealistic BMI and start having certain percentage of weight loss. So we have to reach a pact or an agreement and then move forward. And of course, follow up and reassessment becomes very, very important. While dealing with the patient, while physical activity detailing is important, and the dietary counselings and assessments are important. Very important to understand the psychological impact. The speaker next to me is going to detail more about it, but it is good to know in which of these model of change the patient falls. Are they contemplating change? Are they ready and prepared for it? Are they ready to take action? Are they which phase? They could come to us in any of these phases. There could be some who've tried and tested everything. They've done it. They've achieved some weight loss, and they're only looking at maintenance. That means they would have been on a fat diet. They would have been on a high protein diet, and now are trying to understand how do they maintain this weight, and it does not come bouncing back. So you need to decide and first identify in which of these phases the patient is. There could be a relapse, and therefore some of them are have done several different weight classes, and they always experience the yo-yo, and therefore they're in the relapse phase, or could be very much in the pre-contemplation phase. He's in the pre-contemplation phase. They are not yet considering change, or is unwilling or unable to change. And our primary task in that first consultation would only be about raising awareness, whether in terms of physicality, in terms of physically moving about and the difficulty, or the metabolic impact of ill health. If they're in the phase of contemplating, they've kind of decided, they're arrived at your clinic, that means they're contemplating it. There is a possibility of change, and our primary task is to help them choose how they want to go about doing that particular, bring about that particular change. The third phase is already determined. They're very clear they want to do it. They're committed to change, and we have to just identify appropriate change strategies. That means we quickly evaluate, tell them this needs to be done, and they're quite ready to do it. And you don't have to spend a lot of time convincing them why it is important, because they're already convinced that it is really important for them. Then you have the action phase. They are continuing to do what you want them to do, and we are hand holding them during this phase. But after that comes a more difficult phase of maintenance. This is the period when we lose out on these patients. They don't come back for follow-ups. If we don't have a model of follow-up, also we tend to lose the patient. And therefore, there could be a recurrence, or what is also called a yo-yo effect. So if you know exactly where the patient falls in either of these stages, it's so very easy to understand the mindset of the patient, and accordingly spend more amount of time either raising awareness, or giving them directions, clarifying their doubts, or giving them very actionable goals. I'll also quickly run through what the latest European guidelines for obesity management talk about. They talk about first clinically evaluating the obese patient, which would involve looking at the ethnicity and the genetic predisposition, family history, dietary habits, physical activity, frequency and nature and pattern, eating patterns, whether there are any eating disorders of bulimia, anorexia, etc. Depression, which could be a cause of overeating. Simple anxiety or mood swings could also lead to excessive eating. Is there a genetic factor? Is there a drugs which is leading to it? Because all antipsychotic drugs, all steroids cause a lot of hunger and excessive eating. So once we determine where does the patient stand, then we can determine what kind of dietary intervention we would want to do. That would be one of the indications which will give us clarity as to what kind of intervention do we want to do. Then comes the physical examination. As Dr. Satyendra said, initially when somebody walks in, you are doing a physical examination. You can eyeball them and figure out, but you can do a more detailed nutritionally focused physical examination, where you're looking at the skin, where you're looking at the hair, we're looking at presence of lipomas to see whether there is any hypercholesteremia. You see muscle loss. Is the person already done something? Then has he lost muscle? Has he lost fat? The person sitting in front of you, is he falling into an overweight category simply because he is overweight in terms of the fat mass, or is he overweight in terms of the muscle mass? You could also look for other signs of metabolic derangements, like acanthosis nigricans, which could be a sign of insulin resistance. Very recently, we saw a young 24-year-old who had come for health evaluation because of the COVID scare, and he just wanted a health check from the doctor, and we noticed that he had very dark knuckles as compared to the rest of the body. When the doctor asked him, do you have diabetes or any such thing in your family, or you have it? He said a 24-year-old would say, no, I don't have any of those. But to be doubly sure, the doctor ran through a battery of tests to realize that he was hyperlipidemic, he was overweight, he was borderline hypertensive, as well as had hyperglycemia. And therefore, very important to look at physical examination or nutritionally focused physical examination while the patient is sitting in your clinic. Over and above that, you would want to look at our various lab parameters, which could be your fasting blood sugars, lipid profiles. You could look at uric acid. You should look at uric acid levels, because that could actually tell you whether which macronutrient can be increased. Typically, you would want to encourage a patient to eat a lot of protein, especially Dr. Satyendra did point out about reverse eating. That means you eat your fiber dense meals first, you eat your proteins first, and then you eat your carbohydrates. Automatically you would eat less. But if somebody's uric acid levels are are here and there, then you would want to be very, very cautious about that. You want to look at the thyroid functioning, because you want to see whether he's metabolically active or not. Liver functions like LFTs, as well as fatty liver, which would indicate that calorie intake has been consistently high for quite some time without the patient telling you, because most of the time they're not telling you whether they always present a very good picture about themselves and the right picture about themselves. And it's only when you go very much in detail and ask point to point, or you have a family member of theirs, we would get more insights into their actual eating pattern. And therefore, obesity management has to be comprehensive. It is no longer about just being thin, but it is more about being fit. So you could have a overweight or an obese person, but he's metabolically fit. So you patients might come in with focus on the weight and the weighing scale itself, but we could help them shift that focus from just weight and fat loss to fitness, and that could keep them long term on the road towards better weight loss and a healthier weight loss. And that also prevents them from trying all the quick fixes and the fads, which are all very, very short term and short lived. So the aim of treatment, therefore, should be to lose only 5 to 10% of the initial body weight. That means if you have, let's say, 100 kg person, of course his ideal weight should have been probably 75 or 70. So you don't give them 30 kgs to lose. He gets so demotivated. You tell them lose 10% of your body weight or 5% of your body weight. So you lose 5 kgs, you lose 10 kgs. That's a great way to start. So the initial goals can be as low as 5 to 10%, which would also improve their insulin resistance and improve their fitness levels, which should be an indication, or which should guide them towards focus on better health. While we achieve that, one of the biggest problems with weight loss is also weight gain. Once you've achieved it, many people achieve what they want to achieve, 4 kgs, 5 kgs, and they're super happy about it. But there is a sudden abrupt stopping of both dietary follow-up as well as physical activity, and that quickly could lead to further weight gain. So therefore, maintenance phase is something that they need to understand much before they start getting results, so that they do not very quickly pat themselves on the back or stop something very abruptly and suddenly, which would show very immediate regain of the weight they have lost. So you need to give them very practical weight loss objectives. A 5 to 15% weight loss over a period of 6 months is more realistic and of proven health benefits. Greater than 20% weight loss may be considered for those who have greater degree of obesity, and they do lose, if they have higher obesity and they're following a very good pattern, they do lose much more than a person who's only overweight and trying to lose weight. There could be a category which is failing to lose and maintain weight. And then after having tried for the first 3 years, even in super obese individuals, you could then look at referring them to an obesity specialist, either for a surgical intervention or for a pharmacotherapeutic intervention. At the crux of it is all patient follow-up, whether it is the patients whose responsibility is to follow up, or if you have a clear-cut weight loss program, you should have a built-in follow-up program for the success of the program, for a long-term success of the program, so that the patient does not regain all the lost weight at the end of 1 year or at the end of 2 years. And therefore, we need to focus on physical activity. We need to talk about a lot of resistance activity. We need to talk about, it's not only about going for a walk. Most Indians just want to go for a walk and get rid of the excess body fat, but we need to have a combination and talk to them about fitness, talk to them about frequency, intensity, and the type of physical activity that they are doing. So like in diet, we need to focus a lot on bringing down carbs and bringing down fat, and adjusting the right amount of protein. Even in physical activity, we need to encourage a lot of resistance exercises where muscle building and muscle stimulation happens. At the end, I would also want to mention about cognitive behavioral therapy, which I think the next speaker is going to talk in detail about, because if we understand this, we know how to do behavior modification, because a lot of counseling is about behavior modification and identifying in which stage of change the patient actually is. While everybody, all the medical professionals are very, very important, the patient is equally important and should understand that, and he should be integral part of the program for us to see long-term results. That's about it from my side. If there are any queries, I will take those. If there are any questions, please put them in the chat column, and I would like to answer one or two questions.
Thank you so much, ma'am, for the comprehensive learning we had in terms of nutrition. In detailed talk you gave us about, in nutshell, about the importance of diet, the role diet plays, and the various kind of diet which one should go in for, like low calorie diet or very low calorie diet, and what impact it has subsequently. And there's hardly any difference in terms of the impact. You covered that it hardly has any impact after a year or so. So this kind of awareness is, I think, very important. And thank you so much for updating us with the latest guidelines. And you talked about the various portion size, which is important, and the the behavior change, which is very, very important, because that is where the person gets motivated. And it's a start point wherein he starts with the motivation factor is there. He starts with the treatment, and the adherence is there. So thank you again, ma'am. The question answer session will be at the end of the third speaker talk.
Okay.
Just one more topic on the topic of diet and obesity through the Ayurvedic perspective.
Yeah.
So after that, we'll have a session on question and answers.
Sure.
Now I request Dr. Kashinath. He's the Associate Professor at the National Institute of Ayurveda, Jaipur. And thank you, sir, for joining us. He's the Associate Professor, and he has a rich experience of more than 10 years, both teaching and clinical research. And he's published many papers and also authored many books. So he's been there with us in the last session also on hypertension. Thank you, sir, and we look forward to your hearing as well.
Thank you, ma'am. Thanks a lot. Can I share my slides?
Yes, sir, please do.
Hope my slides are visible. Is my slides are visible, ma'am?
You can see it.
Yes, sir.
Yeah. Sahasraksham Ganadisham Swagaram Cha Saraswatim Janakam Janiyatrim Cha Shastradav Pranamamyaham. Good afternoon, everyone. And today I'm here to present the the role of diet and diet alteration in controlling or preventing the obesity-like condition. And I am here to give the Ayurveda perspective. So before we discuss what exactly the how exactly Ayurveda sees obesity and what will be the pathophysiology of the obesity according to Ayurveda, within a few minutes I will explain all those things, because understanding of these things are very much essential to understand exactly how diet will help in managing the obesity-like condition by Ayurveda. So here, as we all know that in last class we discussed regarding the doshas. So doshas are nothing but they are the biohumors which drives the whole mind and body. And these today here just three parts like dosha, dhatu, agni, and ama we are going in few minutes. So here these, as I said, doshas are the biohumors, and they drive whole mind and body, and also they will influence the formations of dhatus in the body. Here what exactly dhatu consider Ayurveda, in Ayurveda dhatu is nothing but the dharana dhatu, dharana dhatava, that is which gives the shape to the body is called as a dhatu. According to contemporary science, you can consider it as a all body tissues. All body tissue, formation of body tissues are because of influence of all these biohumors, that is vata, pitta, kapha. See here rasadhatu, here in Ayurveda these body tissues they are divided into 7 types. They are called as sapta dhatus: rasa, rakta, mamsa dhatu, meda dhatu, asti dhatu, majja dhatu, and shukra dhatu. So in if you want to correlate according to the modern science, rasa dhatu usually we correlate with the plasma, lymphatic system, or even like serum. So the and even WBC will be correlated to the rasa dhatu. Rakta dhatu, blood, and even RBC will comes under the rakta dhatu. Mamsa dhatu, especially all muscle tissues will comes under the mamsa dhatu, and adipose tissue and even fat, everything will comes under the meda dhatus. Asti dhatu refers to the bone tissues. Bone marrow will comes under the majja dhatu, and semen, all reproductive system will comes under the shukra dhatu. So this is the dhatu concept, how exactly Ayurveda states, and these each and every dhatus are interrelated with the minute channels or micro channels. They are called as shrutas. So here again one very important point we need to understand before we enter into the subject proper, that is Agni. According to the Ayurveda, Agni here it refers to the in simple way digestive power or metabolic activities. Any sort of metabolic activities which is taking place in your body, whether it is in the gut or whether it is in the cellular level or whether it is in the tissue level, everything is because of the Agni itself. So Agni is nothing but the digestive power. Again, Ayurveda divide this metabolic activity or digestive power into 13 types. So we are not going to discuss all those things. In a broader way, we divide this Agni, metabolic activity, into macro level and into micro level. So what exactly macro level Agni here refers, it is called as a Jataragni. That is the metabolic activities which is going to take place in the gut, gastrointestinal level. If you want to compare all the activities shown are shown by the HCl or the food, all the enzymatic activities which are taken place in the total gut proper, it may be working on the carbohydrates, protein, fat, fat digestion, everything will comes under the Jataragni. And another in micro level, all the hepatic changes which are going to happen in our body, it may be like glycolysis, glucogenesis, glyconeogenesis, all sort of metabolic activities which are going to take place in your body, that will comes under the Bhutagni. And another is Dhatavagni. Just we discussed about the dhatus. There are 7 dhatus. Each and every dhatu has its own metabolic activities which are considered as the Dhatavagnis. That is all the tissue level and cellular level metabolic activities, what all happening, that will comes under the Dhatavagni. In such a way, we are going to understand what exactly metabolic activities in the Ayurveda perspective. And here, as I said, Jataragni is the gut metabolic activity. So here, when you consume the food, obviously first Jatragni will be, Jatragni shows its action. Food is totally converted into the rasadhatu. Rasadhatu is the first tissue. So essence of the food converts into the rasadhatu, and over the essence of the food, again rasadhatu Agni will act and it will convert into Raktadhatu. In such a way, in this sequential order, each and every tissues, body tissues are formed and body tissues are nurtured. So one thing I want to focus here, because we are discussing about the obesity. So here, fourth dhatu, you might be seeing that, you might be seeing my cursor. So Meda dhatu is here, it refers to the adipose tissue. So here in Ayurveda, this adipose tissue are classified into two types. One is Baddha Meda, another is Abadda Meda. Here Baddha Meda refers to the stable fat which is present in the omentum or which is present in the adiposity. And Abadda Meda is that which is circulating in manner, that is circulating fat is called as the Abadda Meda, and which is stable at the cellular level, that is called as a Baddha Meda. So according to the Ayurveda, Meda, that is adipose tissue, has divided into two types. Just you keep this in your mind, because while discussing the diet, it is very important to understand this topic. So here another is that when we see the what is the root of formation of this Meda dhatu, we say that Vrukka, that is kidney, and omentum are the places from where this Meda dhatu is formed. See, why I am focusing this one, nowadays we are acknowledging most of the obese people are suffering with the renal disorders. Why it's happening? Because Ayurveda directly says that formation of Meda dhatu will start from the kidney and omentum. That is the reason there is a direct relation between the omentum and the kidney. So obese will be more prone for the renal conditions. That is the reason there is a direct relationship. So next, another point to understand is ama. Ama in simple way, if you want to understand, it is a indigested body. Whenever you consume the food, ama. So what will be the characteristics of these undigested particles? Ayurveda says that undigested particle will be abnormal to see, and it will be of sticky in nature, and it will be of foul smell. So whenever these undigested particles start circulating in your body, when it starts from moving from one tissues to another tissue, one dhatu to another dhatu, there is a more chance of obstructing these microchannels. Once if this moving undigested particle, if it obstruct the Rakta dhatu, then the person will show many disorders related to the Rakta dhatu. In the same way, if these undigested particle affect clogs the Mamsa dhatu, the person will suffer with the lots of muscular ailments. In the same way, when ama affects the Meda dhatu, then the person may suffer with he may show the complaints related to the fat metabolic disorders. So here, how exactly pathophysiology will takes place with this ama in obesity. So Ayurveda consider obesity as the Medo Vikara. So here just I would like to say, if ama affects the Baddha Meda, as I stated that Ayurveda states that fat is of two types. One is stable at the center, at the cellular level, another is circulating. If ama affects that stabilized Meda, then it will induce us the condition called as obesity. Today I am going to focus on obesity. If same ama, undigested particle, if it affect the Abadda Meda, circulating fat, then the person will show various disorders, like where it will go and settle, where this ama go and settle, where this ama takes this Abadda Meda and get settled, then the various disorders will occur. Like for example, if it ama takes this Abadda Meda and it's settled in the circulation, the person will suffer with the condition like hyperlipidemia, sometimes hypercholesteremia. Same thing if this Abadda Meda with ama, if it settle in the muscle, then person will suffer with the condition called as lipoma. Same thing if Abadda Meda with ama settles in the liver, person will suffer with the fatty liver. If it settles in the pancreas, then the person will suffer with the diabetes mellitus. In the same way, it settles in the thyroid gland, the person will suffer with the hypothyroidism or hypothyroidism. If it settles in the ovary, then person may suffer with the PCOD or polycystic ovarian like conditions. So ultimately today I am going to focus on only one part, that is ama, which is affecting the Baddha Medas, that is obesity. So in Ayurveda purview, all the fat metabolic syndromes will comes under the heading of Medo Vikara. So if there is any deposition, if there is a excess deposition of the fat in the body, then that is called as a Medo Vritti. This is considered as the predominant symptoms of or the obesity like conditions. And when these Baddha Meda, that is when Medas accumulate and collect at the center over the abdomen, that is central obesity, what we call that is considered as overweight. Ayurveda state it as a stula kaya. If it is more, again, if there is excess accumulation of the fat over this part, then that is called as obesity. In Ayurveda terminology, it is called as a atistaulya. So here again, Abadda Meda I already discussed how exactly fat metabolic syndrome should be considered in our Ayurveda. So again, obesity related complaints, what are the etiology? We all know that one. Like for example, food cause, if the person induces, take excess amount of fat, carbohydrates, processed food, refined food, and if the person have the habit of taking excessive food, repeated intake, then again it will induce us the obesity like conditions. In the same way, if the person is psychologically disturbed, like if he's chinta grasita, or if he's depressed, or if he's anxiety in nature, then obviously again it will reflect over the metabolism of the body. So again, other miscellaneous cause of all these fat metabolic syndromes in Ayurveda, even they says that even there is a involvement of bija dosha, that is genetic, or it may be the hereditary cause. So here, just I would like to say before I am going to the diet pattern. So the effect, this is one of the research article which says that effect of increased meal frequency. Here they want to say is that excessive intake and excessive small quantity and repeated intake also induces the complaints like obesity, and even that will triggers the or small quantity repeated intake will also increase the hunger and appetite.
The Google Meet will, because of time positive, it will get over by 1 o'clock. So we have to be really very fast and to cover question part also.
Okay. So this is the symptoms of obesity. We all know that, even Ayurveda says same in the same way. So here, coming to the diet management, actually we have two methods of diet management. One is primary protocol and secondary protocol. Primary protocol, we preferably focus on the rectifying the cut fire, and later we will try to take out the blockage which is caused by the undigested particle, that is ama. And so here we all know that one basic sutra for managing the obesity like condition according to Ayurveda is Guru Chatarpana. Guru Chatarpana is nothing but the making the person to take heavy food, but which are non-nourishment in nature. Same in the modern way, we know about the keto diet and vegan diet, paleo diet, which is called as the hunter's diet, or even Stone Age diet, Atkin diet. These are some of the diets which also act, or which also have the similar principle, that is heavy but they are non-nutritious. Heavy and not nutritious, obviously fiber rich diet. So taking low carbohydrate and low fat, excessive intake of protein and excessive intake of fibers will have the quality of Guru and Atarpana, heavy and non-nourishing. So preferably food which are having the taste like pungent, bitter and astringent, these will be having the property of Guru and Atarpana. Preferably we should go for intake of food which are pungent, bitter and astringent. So here again, these are some of the disadvantage of diets which are very much prone, keto diet like that. So they says that keto diet, continuous intake of keto diet also has its own impact over the body. So ultimately, whenever we are adopting any method of diet pattern, so there should be a standard principles. We are not supposed to blindly accept all those things. And even the dash diet, why I want to share this aspect. So while in dash diet, preferably it is indicated for hypertension, but some research study also shows that it is even helps to reduce the cholesterol level. So even with the obesity person, we can go for the dash diet. And coming to the Ayurveda perspective, which kind of diet we can advise? As I said, preferably if the person is obese in initial time, in initial first phase, we are supposed to focus on those food, preferably like barley and wheat, which are freshly harvested. So newly harvested foods like barley, wheat and even all millets like kodu and even sawa chawal, ragi, bajra, this kind of millets which are newly harvested should be advised, because they are guru in nature, and all these millets are guru in nature, but they are not much in, nourishing your body. They will be having shows the effect similar to that of rich fiber. In the same way, when it comes to the intake of the pulses, obviously like pulses like Bengal gram, horse gram, kulti especially, this is very much good pulses which affects which helps in reducing the adiposity. So kulti is very rarely consumed, but if you advise kulatta, that is horse gram, that also helps to reduce the fat, adipose tissue, and green gram, that is mudga, that is also very much essential. Then here preferably you should think that these grains should be freshly harvested. And when it comes to the intake of Phalavarga, we know that one, there is a beautiful quotation of Ganesha, Kapitta Jambu Palasara Bhakshitam. So here obviously they says that mythologically Lord Ganesha is hefty and he is obese. So for them usually we offer jamun, we offer avla, we offer keti. So these are the some of the fruits which are preferably essential to reduce the obesity like condition in initial time. And even anar, it's also best fruits for the, and when it comes to the vegetables, as I stated earlier, any food which is dominant of,
We've been able to increase this time slot, so you can you can do it as easy as you want to.
because ma'am, because
there is no restriction on time now, sir.
Okay,
we've been
thank
able to increase the time slot.
Okay, thanks a lot. So here, as I stated earlier, while selecting any kind of food, I stated for the obesity in initial management, we should take food which are dominant of pungent, astringent, and bitter taste. So preferably these are the some of the vegetables which are dominant in bitter taste, especially patola, parval jo bolte hain, vastukam, that is batwa, methika, that is methi, and karavellaka, here it refers to the karela, which is rich, which is bitter in taste, and even amaranthus, tanduliyaka, and kachri, what we say bimbi, kachri jo hum khate hai, that is also good in obesity like condition, and onion, and even radish and carrot. These are the some of the tubers which are essential, which are very much essential to manage the obesity in early condition. I'm again and again I am telling you to, these are preferably advised in the early stage of management, not in the late stage of management, early stage of management. And when it comes to the selection of the oils, which kind of oils are preferably advised in the initial time, preferably we should go for intake of atasya taila. Ayurveda says atasya taila is nothing but the flaxseed oil. Nowadays there is a trending of eating the roasted flaxseed. Even there is availability of flaxseed oil. If you go for that one, that will be a good choice for reduction of the body weight. In the same way, mustard oil, Ayurveda says sarshapa taila, and gingerly oil or sesame oil. These are also very much essential to manage when it comes to the management of obesity like condition in initial period. And coming to the selection of kshira varga, that is milk product, preferably Ayurveda suggests godugdha, that is the cow milk is only best to manage the obesity, not other than cow milk. And there is one reference saying that camel milk is also very much best in reducing the obesity like condition, that is ushtra kshira we say in Ayurveda, that is camel milk, or else you can go for godugdha. And when you are taking the cow milk, it is must that it should be always warm. You are not supposed to take the chilled godugdha, because chilled godugdha again it will increases the obesity like conditions. Always we should take cow milk which is warm. And while selecting the non-vegetarian, preferably we should take the meat of such animal which belongs to the arid region. Arid region, all Rajasthan is the place which comes under the arid environment and arid climate. So here mamsa, that is intake of meat is advisable. But the people who are staying in the South India, which comes under the marshy places, they are preferably not supposed to take the non-vegetarian food while managing the obesity like conditions. And ultimately in initial protocol of management of obesity, preferably all spices, Indian spices are Indian spices plays very important role in reducing the adiposity like conditions, preferably like haridra, haldi, kali mirch, and even dalchini, lasan, and shont and what we call ginger. So these are the some of the spices preferably helps to mitigate or preferably help to take out the deposited adipose tissue, not only in the cellular level, even if there is any circulating fat like hyperlipidemia, hypercholesteremia, even these spices are very much essential. But whenever we are taking the spices, we should be very vigilant enough while deciding the dose. Ayurveda suggests that dose of spices should not be more than 6 gram per day. If you take excessively, it may induce the complaints like hypertension. We all know that one obesity is the one of the major culprit which may give rise to many diseases like hypertension. If you excessively go for intake of spices, if you don't focus much on the quantity of the spices, then it may give rise to complication as a hypertension. So while taking the spices, you should be bit vigilant enough. And coming to the pana, which kind of drinks are preferably advised? Ayurveda preferably suggests that Triphala is the one of the herbal drug. So decoction which is made by the Triphala, that is well and good to reduce the weight, and or else very simple way, making the water or what we call water, which is water which is prepared by adding the ginger, sont, what we call ginger water is also best to reduce the body weight. And there is a herbal drugs called as asana. So that is also one of the best drug. If you prepare whole water throughout the day and repeatedly whenever you feel thirst, if you go on drinking this kind of water, that will also regularly help to reduce the obesity like conditions. And these are the some of the food preparations which are preferably made out of those cereals what we discussed, like all millets. As I said, millets are rich in fiber. That is the reason all millets are preferably advised in obesity like conditions. So like with the help of millets, you can prepare variety of foods, like it may be the idli, you can make the ragi with the help of ragi, that is finger millet. You can go for preparation of the idli, dosas, and even you can prepare the with the help of parboiled rice, you can prepare the pulao. And you will see this, even you can go for preparation of ormilon or like chow mein, and even roti, and varieties of food can be done. Because if you don't make varieties of food, then obese people will stick on to the particular diet for few days, because after few days he will be fed up with the routine thing. So ultimately we are supposed to serve them the different food in different form, then only it will attract and it will make the person to stick on to the particular diet. If you focus on only single diet, so for a few days he will follow, then later he will revert back to the normal diet. And these are the some of the porridge which are prepared by with these millets. You can go for using these varieties of millets. It may be ragi, or it may be sawa chawal, or it may be like bajra. With these you can make prepare various porridge. It can also be advised repeatedly whenever the patient feel hunger. This will also, because of low calorie and they are rich in fiber, it will help to reduce the obesity like condition. So these are the some of the methodologies which are supposed to be practiced in initial time. Why I am saying that, when it is a initial condition, initial time of management, we should go for freshly harvested food, and there should be always limitation for everything. See, you know that why keto diet is failure now, because while advising the keto diet, there was no any limitation for that. If once it was advised, people are taking continuously. And some photos previously I was running out the slides. There was a data saying that one of the recent actors died because of prolonged keto diet. And even because this continuous intake of keto diet, sometimes it may take the lives of the person. So ultimately, for everything there should be a limitation. So what should be the limitation? When we should stop taking such kind of food? If you are taking the keto diet, if you are taking Atkins diet, or if you are taking any paleo diet, when we are supposed to stop such food? So ultimately, we are supposed to see certain characteristics in your body. If the especially BMI, body mass index, if it reduced to bit 1 or 2 degree or 2%, then that indicates that we are supposed to switch off that keto diet. Then we should shift to the some other diet. So ultimately, and there is a one more you might be knowing that. That is called as bioelectrical impedance analyzer. So that is one of the analyzer which will help to analyze the subcutaneous fat and even visceral fat. So whenever you are advising any kind of diet, make the person to undergo this test. It will make you to find out what is the level of visceral fat and subcutaneous fat. That is bioelectrical impedance analysis methodology. So this will help to assess these things. Once if they are coming to the normal, then we should switch, we should stop the such kind of diet. Then gradually we should move on to the normal diet. If you doesn't do, then there might be chance of any complications. So in later stage, what we are supposed to advise. So if the person shows decrease in the BMI, and if you start showing some decrease in the cholesterol level, then obviously we should switch on to the easy digestible and normal nourishing food. And here we are supposed to advise the food which are dominant in amla, that is sour, salt, and less amount of sweet. So in later stage of management, we should go for intake of such kind of food. In initial management, I advise to take the food which are dominant in the taste, like bitter, pungent, and astringent. But later stage of management, we should go for intake of the food which are dominant in sour, salt, and sweet. And preferably all food should be hot in potency. Again, for this also there is a limitation. If the person, when he come to this stage, again after a few days, again if the BMI go on increasing, then again we should stop this methodology. Again we should switch on to the earlier stage. So here, when it comes to the management of obesity in later stage, here initially we discussed about to take the freshly harvested food. Now here in later stage, we are supposed to take the food which are year-old harvested food, which are old grains. We are preferably like yava, that is barley or wheat, which is of 1 year old. Preferably we should advise, or else you can go for intake of whole grains, or preferably dalia. Ayurveda advice, we should not take flour or any atta, because atta, pishtana, Ayurveda says pishtana, which has tendency to increase the body fat. So preferably you should go for intake of the chorus powder, that is dalia like content from of barley or wheat. And while selecting the pulses, again as I said, ultimately 1 year old harvested the grains are supposed to be advised, preferably like Bengal gram, Harsh gram, and even green gram. And here, whenever it comes to the management of the obesity, we should not go for intake of black gram. Udad ko kabhi bhi nahi lena hai, because it increases the body fat. And when it comes to the intake of fruits, we discussed all those things earlier. So these are mandatory for all the stages, in initial stage and later stage. These are some of the fruits which are preferably advised, because they are rich source of fiber, and as a whole fruits they are supposed to consume, not any milkshakes. Milkshakes, again it will add on the calorie to the body. So as a whole fruits can be consumed. And again, as I said, these are some of the vegetables, all vegetables preferably, because they are rich source of fiber, they are advised to intake. And when it comes to the selection of the oils in the later stage of obesity, when the person starts decreasing the body weight, at that time, then gradually we should switch on to the intake of sunflower oil or safflower oil or sesame oil. These are the indications which Ayurveda advise. So preferably they are rich source of, especially vegetables are rich source of polysaccharides. They are rich in micronutrients, and mufa and pufa, especially these oils. So these are preferably advised in the later stage, not in the early stage. Again, spices, as I mentioned earlier. And when it comes to the selection of the drinks, so when the person already reduced the weight, at that time, if you want to maintain that weight for a longer time, then you are supposed to advise certain drinks. Preferably, madhu mishrita jala is nothing but the water which is prepared with the help of honey. Honey, when we are selecting the honey, then honey should be, again, it should be older honey. As much as old it is, then that is good for reducing the body weight. So if you have any honey which is a 5-year-old, that is well and good. So older honey is best to reduce the weight. So you are supposed to prepare the water with the mixture of the honey, and you should drink. That will help to reduce the body weight. But there is a wrong practice. People are wrongly practicing the madhu with water, that is honey with water. They are taking the honey in the hot water, but Ayurveda preferably condemn this practice. We are supposed to take the honey always with the neutral water, not with the hot water, because Ayurveda says that mixing the honey with the hot water, it acts as similar to that of the poison. And again, there are certain herbal drugs. With these herbal drugs, we can prepare the drinks, and oftenly, whenever you feel thirst, you can go for intake of such kind of drinks. And preferably, in any stage of obesity management, these are some of the contraindicated food, like sugar. When it comes to the selection of the cereals, any food products which are prepared by the cereals are monocotyledons, refined flour, as I stated earlier, bread, noodles, pasta, biscuits, because these are all made out of flour. Ayurveda says pishtana is kafakara, which increases the obesity like condition. Puri, jalebi, and even in the morning, sir was discussing about the kachori, samosa. So such things are preferably not indicated. And in the pulses, as I stated, masha is nothing but the black gram, and any item which is prepared by the black gram, it may be the papad or idli, dosa, dokla, such kind of foods are preferably not indicated in any stage of management. And when it comes to the selection of the non-vegetarian, ultimately meat of any animal which belongs to the marshy places, they are not supposed to, marshy places and aquatic animal meat is not supposed to be taken while managing the obesity like condition. And preferably when it comes to the selection of the fruits, and banana, that is mocha rasa, what we Ayurveda says, falasa is nothing but the jackfruit, and mango, and even guava, these are some of the fruits which are not supposed to be advised in any condition, any stage of obesity. And preferably all root tubers like potato and sweet potato are totally contraindicated. And when it comes to the selection of the alcohol, so preferably new alcohol are totally contraindicated. If you have like 10 years, 15 years old wine, that is indicated, but new wine is totally contraindicated according to the Ayurveda principles. And these are some of the panas, nowadays carbonated drinks what we are getting, because they are enriched with the calories. We are not supposed to go for intake of these drinks. And even all milk products, Shira Vikruti is nothing but the all milk products, especially paneer, kheer, ice cream, or even Shrikhand or Rabdi. Such kind of foods are not supposed to be taken when it comes to the milk and milk products. Only pure cow milk is advised. Other than that, other products are not indicated. And while selecting the sugarcane products, preferably jaggery, new jaggery is totally contraindicated. If you get old jaggery, 1 or 2 year old jaggery, that is indicated to reduce the body weight. As I stated, milk and milk products, Mahishi Dugdha is nothing but the buffalo milk is totally contraindicated, and anything which is made out of buffalo milk, and even like it may be like paneer, anything which is made, that is totally contraindicated. So here just I would like to say one beautiful line what we get in K Park: what people eat is not calorie but the food. Considering the fats, flavor, and variation of the appetite can make a nonsense in dietitian theory. So holding this line, I published one article. So what they want to say is that what we consume is the food, not the calorie. Because if you advise any food in the basis of calorie, obviously it is not going to work, because every day, every minute, appetite of the person is varying and the taste of the person is varying. If you don't think these things, just if you focus on calorie, then obviously dietitian theory will become futile. That is the reason Ayurveda, whenever it advises any kind of diet, always it says that matra shishyat ahara matra punaragni balapekshini. Every time whenever you are consuming the food, you should assess your jatragni, you should assess your appetite, you should assess your mental status, whether your mind is allowing to have food or not. When you assess all those things, then obviously you will get the good result. Without assessing these things, just if you go on taking the calorie based diet, then obviously even though if you are serving the well calibrated calorie diet, that will also give the disadvantages. That is the reason always we should think about the appetite of the person, we should think the fats and the flavor of the person. Accordingly we should serve, and we should modulate, we should modify the food, and you should serve. So when we advise the food intake, certain points we will miss out, especially like before meal, what we are supposed to prepare ourselves. Because if you advise good calorie diet, but before meal, this Ayurveda advise certain activities. If the person's body is not prepared, even though if you advise appropriate calorie diet, even the calorie diet also induces the obesity like conditions. So before that, Ayurveda always says whenever you are having any kind of food, you should prepare your body. You should prepare your mind and body. So ultimately Ayurveda says that you should assess your appetite. After assessing your appetite only, you are supposed to consume the food. If your appetite is very poor, if your appetite in the sense indirectly it says that your metabolization is poor. When it is poor, then you should not consume the food. And even Ayurveda says that before you are having food, you should take the appetizers. Bhojanagre Sadapatyam Lavanadraka Bhakshanam. Ayurveda says that before food, garlic and rock salt combination should be kept in your mouth at least 15 to 20 minutes. It will ignite your Agni, it will ignite your digestion system. Once if your digestion system is ignited, then whatever you consume, that will get properly digested. And preferably Ayurveda condemned to intake of salads. Nowadays, when we start taking any kind of food, we start with the intake of like kira, kakadi, and even cucumber, radish. These we start from the we start early from the food. So whenever you are taking such kind of salads, Ayurveda condemns. We are not supposed to start the food with the salad. That is vina mocha phalam tad varjiniyam karketikam. Salads, preferably salad mein kira, kakadi, that is cucumber, is totally prohibited to have before food. And when it comes to the selection of the water, again, Ayurveda says that one, annasya ado jalam pitvam karsham mandagni kurta. If you want to reduce your weight and the person is obese, you advise the person to drink water before food. At least 1 glass of water if he takes before food, that will help to reduce the weight, because it says that annasya ado jalam pitvam karsham mandagni kurta. It will reduce your metabolic rate, and because of the reduction in the metabolic rate, the person will reduce his body weight. It will induce the cachexia, that is karsha. Ayurveda says that to reduce the body weight, make the person to drink the water before food. And even whenever you are choosing the any place, preferably, as I said, mind and body are interrelated. If your mind is stable, if your mind is calm, then only your metabolization will be normal. So whenever you are selecting any kind of place, it should be calm and comfortable. So these are some of the data which says that pre-meal water consumption and energy intake. So this study says that one, taking the water before food helps to reduce your body weight. Same Ayurveda also says in the same way. And even water intake and intra-meal fluid consumption in relation to the general and abdominal obesity of Iranian adults. Here this data says that the person who drinks excess water in between the food, that will also help to reduce the body weight. And throughout the day, the person who drink very less water, throughout the day, the person who takes less water, he will reduce the body weight rapidly. And while having the food, the person who takes excess water in between the food, then that person also reduces the body weight. So this is the beauty what Ayurveda also says. And one thing, as I stated, seating pattern, because we don't focus on seating, how your posture should be while having the food. Ayurveda says that Sukhamuchai Samasine Samadehe Anna Tatpara. We should sit on the floor and you should consume the food. But people, we don't do that one, because research says that the person who sit and have the food, in them there will be a normal distribution of the fat, and the person doesn't increase his body weight. And the people who stand and have the food, those people are going to increase the body weight rapidly compared to any other people. That is the reason for obese person, always advise them to sit and have the food instead of going for. So next, a very important part is modification. As I stated that the person what eats what a calorie food. Ultimately, some modification are supposed to be done, because if South Indians are very much for South Indians, staple food is paddy, that is rice. For them, if you advise rice is going to increase the body weight, if you advise them not to eat rice, then obviously he can't follow that rules for many days. Instead of advising the restriction, we should go for alteration. That such kind of alterations Ayurveda elaborate very beautifully. So whenever you are selecting the barley or wheat or even paddy, as I stated, Ayurveda suggests to take the old rice. If you don't get the old rice, then at least you should go for barjana, that is roasting, or else you can soak where you want to soak. Ayurveda says that you can soak these grains in the Triphala Kavata, that is Triphala Kashaya, the decoction which is made out of Triphala. All night if you soak, and next day if you dry it and make the flour and take that one, that will also helps to reduce your body weight. And even soaking the these grains in the oil, preferably castor oil. Castor oil is eranda taila jo bolte hain, erandi tail. So if you soak these grains in erandi taila, and that is in castor oil, and next day dry it and flour and flour it. So such kind of food again helps to reduce your body weight. And one more thing, obese are very much prone for constipation like conditions. So if you go for grains which are soaked in eranda taila, that is castor oil, that will also relieve the complaint of constipation in obese. Or else you can go for prasrushta, dauta, prasruta. So these are some of the methodologies. Ayurveda says that repeated washing of the grains before you cook the food, that will also make the food light for digestion. In the same way, and cooking the food in open vessel. Ayurveda says that you should always cook the especially rice in open vessel, and whenever there is a formation of the rice gruel, you should pour it or you should discard it, then you should consume. Any food which is prepared in the open vessel will help to reduce the body weight instead of going for cooker prepared foods. Cooker prepared food will increases the body weight. This is the Ayurveda concept. And even they says that whenever you are making any chapatis, whenever you are making any dough, in dough preferably you make use of the spices. If you make use of the spices in this flour and make a chapatis, then that will helps for the easy digestion, and that will helps to manage the obesity like conditions. So such kind of modifications can be done. And millets, as I stated, preferably you should go for intake of millets, preferably like ragi, bajra, sawa, kattu. This will helps to reduce the, and even I shown lots of pictures. So varieties of dishes can be prepared with these millets and cereals, that will make the person to maintain the continuity in having the food. And while and this regarding the pulses I stated earlier, and when you are selecting the vegetable and fruits, preferably seasonal fruits and habitat food, in which place you are staying, in the same foods or vegetables from same place you are supposed to consume. You are not supposed to consume the food which is very much prone in the South Indian. In North India, if he consume excess amount of coconut, then he will be victim for obesity like conditions. That is the reason in which place you belongs, preferably you try to eat the food and vegetables of the same place. These things I already stated. And this is one of the article I tried to enumerate that how modification you can do while selecting the food. So on the basis of Ayurveda principle, I try to modify, like whenever if you want to prepare the chapatis, how modification you can do. So such tips I try to write in this article. If you find, you can go through this one. So as I stated, meal frequency and time, because Ayurveda states that we are supposed to have the food twice a day. And even nowadays, especially intermittent fasting is booming because it helps to maintain the body weight. Ayurveda earlier it stated that we are supposed to take twice a day meal. And skipping breakfast, again, if the people skip the breakfast to reduce the body weight, it is never going to happen. Skipping the breakfast, again, it will increases the body weight. Instead of that one, you should go for having twice a day meal, morning and in the morning, which time preferably Ayurveda advised that 9:30 to 10:15 is the appropriate time, and the evening preferably you should go for having the dinner between the 7 to 8:15. This is the appropriate time Ayurveda advises. And after having the food, again Ayurveda also says that when we are supposed to adopt certain etiquettes to digest the food what you consume. If you don't etiquettes after having food, if you go and lie down, again obviously even though if you taken the high calculated food, again it will induce us the obesity like condition. After meal, what you are supposed to do, again Ayurveda says that Bhuktvat Rajavat Asit. You are supposed to sit in Vajrasana, diamond pose. That will helps to improve your. That will helps to digest the food what you consume. And Bhuktvat Shatapadam Gachet. After food, the person has to walk at least minimum to minimum 100 steps. That will also help to digest the food what you consume.
Dr. Kashina?
Yes, ma'am. Oh, last slide, ma'am, last slide. So the and even having the tambula and herbal smokes, and this is also one of the article what I wrote. What we are supposed to do consume the after consuming the food, because if the food consumed is digested properly, then only it is going to maintain the normalcy of your body, or else it will induce the conditions like obesity. And finally, I would like to conclude that on the basis of the stage of the disease, diet prescription should be done rather than advising the restriction. Always we should think about the modulation, and that modulation, whatever you are going to do, that should be adhered to the principles. So it should not be like a weird method of modulation. And always whenever you are advising, you should give importance to the metabolization, that is Agni. Assess your Agni, according to that you are supposed to advise the food. By these few words, I would like to conclude my talk. Thank you.
Thank you so much, sir, for enlightening us with the knowledge of Ayurveda. You discussed in detail about various kinds of food products which could be used and which are beneficial in controlling the obesity, about the various dhatus and according to the kapha pit, and what concept of the interrelated with Srota's macro level and various you talked about the Bada Meda and the Abada Meda. So I think depends on the kind of indigested product and the Medo Vikara which you talked about. So thank you again, sir, for telling us. We'll start off with the query, sir. But first query I would like to ask you is, in the last session which you talked about diet and hypertension, you said that it shouldn't the 1-year-old cereals or product pulses shouldn't be given to people with hypertension. Is it right,
Yes.
sir?
Yeah.
And for the obesity, whereas you recommend that it should be prescribed. The older 1-year-old cereals or products should be prescribed. So what if there is a comorbidity with obesity with hypertension? How would you deal with that?
So at that time, obviously, ma'am, instead of going for newer grains, always again you should go for older grains itself. But while making some processing, then processing methodologies like especially I forgotten to say about the what we call ghee. That is ghee. So Ayurveda says that whenever you are preparing any kind of food, you should go for use of ghee. So ghee will helps to maintain your Agni. And whenever you are taking the amount of ghee, considering the ghee, and it should be limited to the 5 gram. So 5 gram of ghee will helps to enhance your Agni. So when it comes to the managing of the both the conditions like obesity and hypertension, because Ayurveda even says that ghee, especially Grita, Ayurveda says Grita helps to maintain the Pitta as well as Rakta, and even it will helps to maintain the Vata. So three doshas are maintained by the ghee. That is the reason you can use the ghee whenever you are doing any processing of the food.
Okay. Thank you so much, sir. Now we have few questions which I would request all the speakers to answer as per their choice. Which type of edible oil is better, blended oil or individual refined oil? I think
in oil choice, we have also mentioned on the style that polyunsaturated fatty acid, the oils which have more polyunsaturated fatty acid like soybean oil, sunflower oil or corn oil, these should be preferred over the saturated oil.
Okay, the second question is, should we be reducing calories according to age once you cross 60, if you're above 60?
So the calorie intake, that depends on the first physical activity. Usual recommendation is above 40. Then in adult, a male should consume approximately 2,400 calories. Then above 40, 2,200 calories, and then 2,000 calories. But if person is physically active, then we can add plus 200 calories. And for the females, same age group, we should decrease the 200 calories. Like a young female, 40 to 60, 1,800 calories are sufficient, while above 60, 1,600 calories are sufficient. But if female is physically active, then we can add same like plus 200 calories. So that depends on the age plus physical activity. So guidelines are clear. If physical activity is more, then we can add plus 200. And with increasing age, calories should be decreased, because obviously with increasing age, physical activity is decreased.
Thank you, sir. There is another question. How healthy is the keto diet? Is vegan diet a healthy diet? If ma'am can answer this question.
Yeah, Dr. Rashmi. I think all the three speakers very clearly spoke about, how keto diets are extremely short-term based and have to be done under medical supervision. I think that is something one has to be clear about. And therefore, it cannot be very randomly done as per, individual choice and preferences. Secondly, vegan diets are definitely something one can try. However, keeping in mind that they may be low in protein, they may be low in calcium, they will also be low in certain nutrients like B12. And therefore, the constant advice is to not go in for fat diets and rather do a simple balanced meal. Now, if you look at our Indian meal, which is a thali, it is a perfect example of a balanced meal. And as far as there are no excesses in terms of excess sweets, excess oily food, that is a good perfect example of a well balanced meal, which we should keep in the two major meals which Dr. Kashinath was talking about.
So, ma'am, there's another addition to this question. Can we advise intermittent fasting, the benefits of intermittent fasting? Is there a long-term side effect to it?
So my personal opinion, and also based on the very latest publication which we have seen, that whether it is total energy restriction or intermittent calorie intake, both of them over a long period of time, especially after a year, if you look back and look at the results of it, they are similar results. So after several after several years of being in practice, it's my personal opinion also that you need to look at the overall aspects. You look at physical activity, you look at total energy intake, and cut down on the unwanted food or the wrong kind of food, and make an overall lifestyle change, which will help in bringing down the weight of an individual. With intermittent fasting, what I've seen is people can't follow it for a long period of time, and therefore tend to give it up very quickly after they see results. And then there is a weight gain that people see, and at the end of it, at the end of 1 year, you see not much changes or a difference in either energy restriction or intermittent fasting.
So hardly any benefits found, ma'am.
Yeah, you see very immediate short-term goals, and therefore it's so very popular.
Yeah, thank you, ma'am. There is one question to Dr. Kashinath. Is Mishri good for weight loss?
It's not good for weight loss, ma'am, but preferably, as I stated, in early stage, we are not supposed to go for intake of this mishri like that. But later stage, like after the body start responding, after body start reducing the weight, then later gradually we can switch on to intake of mishri. Because again, compared to sugar, it's a refined one. So it's a semi-refined mishri. So you can go for intake of semi-refined like mishri, or else you can go for intake of jaggery.
Exactly.
But selection should be done in
Kind
the
of
late stages of the, yeah.
Okay, thank you, sir. There's one more question. How much will short nap after lunch affect weight gain? Please suggest and clarify. Walking after dinner, does it help, or it affects the weight gain process?
Pardon me, I could not get, your voice is bit
Yeah,
breaking.
there is a question that will a short nap after lunch advisable? Will
Yes,
it
ma'am.
help in weight
It's
reduction?
advisable. Ayurveda clearly says that, like Bhuktvat Upavishet. After Bhojan, after having the food, person should sit for a while. That is, as I said, Rajavat Tasit. You are supposed to go for sit in Vajrasana, that is diamond pose. And many research says that sitting in diamond pose also increases your digestive power. So consumed should be properly digested. And Bhuktvat Upavishet. If you sit normally, not in Vajrasana or diamond pose, if you sit normally, so that will increases it will reduces the digestion power. Preferably sitting should be in Vajrasana, not other than Vajrasana. And if you lie down, they had given said if you lie down, left lateral posture up to 8 breath you should lie down, right lateral posture up to 18 breath you should lie down, and after this supine posture you can lie down for near about 32 breaths. After that you should indulge in walking. So walking will helps to digest the consumed food. If you indulge in running like that, then it will leads to the mrityo davati. If you run, it will takes the lives of the person. So these are the sequential methodologies Ayurveda suggests.
Okay, so you mean to say that after lunch one should sleep, and after dinner one could walk,
Now,
right?
even in lunch or in dinner, he should sleep hardly for 5 to 10 minutes. Five
Only
to
for
ten
five.
minutes, and they had given the certain posture, left lateral posture for 8 breaths, right lateral posture for 12 breaths. So in such a way, you should sleep. Then later you should indulge in walking.
Alternately. Okay, thank you, sir. There's again one question. I think ma'am could answer this. Please explain metabolic fitness versus overweight.
Yeah. I think this is something each one of us who is, doing some kind of a therapy for weight loss should understand that very clearly. When we talk about metabolic fitness, we are talking about whether your sugars are under control, your, blood pressure in the normal range, is the individual suffering from hypercholesterolemia, all those which either are in the phase of metabolic syndrome, which is a pre-disease state. You try and evaluate them at that point of time and correct that even before the disease state actually presents itself in a symptomatic manner, or it shows you in the biochemical parameters. And therefore being metabolically fit is far more important than only correcting your weight in terms of obesity. Of course, both should be a goal, but one of your major goals should be to ensure that you're more metabolically fit, which if not there could lead to several disorders. So you could have individuals who are obese but metabolically fit. They are far better than those who are thin in the normal BMI range and not metabolically fit. So therefore, you need to look at both of them.
Exactly. Thank you, ma'am. Another one is how to manage diet in kids, as it is one of the leading health problems nowadays seen.
Diet and
Diet for kids,
yes, diet for
control the
kids is,
weight.
I think, in our traditional outlook, we generally think that kids can eat whatever they want to eat. There is no need for any restriction for kids. It's only a very modern way of looking at it, so on and so forth. So if you look at this current pandemic situation, the last 6 to 7 months, we've actually seen kids gain weight tremendously. They're not fitting into the clothes that they were fitting 6 months back, and therefore it is equally important for them, because So many of them either don't go for physical activity or not allowed to go for. There's so much of studies, so much of sitting that is happening in this current situation. Also, if the child cannot go out or should not go out, some amount of physical activity should happen at home. So you need to look at their diet. You need to cut out a lot of simple carbs which kids take. Kids take a lot of sweets, chocolates, ice cream, soft drinks. And when they become adolescents, they would do it quite discreetly without you and without the parents knowing about it. So you need to identify simple carbohydrate intake in children. Eating out is a very big thing which contributes to obesity. So that needs to be curtailed, and we need to try and encourage them to have as much as home food as possible. Yes, it needs to be looked into, because not only being overweight, but childhood obesity is something that is, standing and hitting in our face, definitely.
Absolutely, ma'am. But it's become a trend nowadays. Children want to eat outside.
Yes, they don't like home cooked food. So you allow
Yeah.
them once, they want to do it twice. You do it.
So again, I would say a behavior modification is required.
Yes, absolutely. And what you do collectively as a family is also equally important, because if the family goes out very frequently, the child thinks it's absolutely okay to eat food out very frequently. So
That is
whatever.
where we always say, while planning a meal or planning a menu, children's views or should be incorporated. The deciding the menu for the day. So that is
Yeah,
how they know the
but
importance.
sometimes they can be very, very manipulative. They want all the bad things and not the good things. So you need to know where you want to be very, very firm. And I love what Dr. Kashinath presented as well, that there is already so much of information about presence of obesity. How do you deal with it? What are the different kinds of food which could contribute to it? And learning that up in the school, at a very young age, would really, really help. And integration of both dietetics and Ayurveda is the need of the hour, certainly.
Yes, very true, ma'am. Integration of all alternative therapies should be considered.
True, true, very
Okay,
true.
sir, there is a question for you. What differences in nutritive value occurs in grains kept for 1 to 2 years, apart
Yeah.
from moisture reduction, based on which Ayurveda will you recommend it as indicated or
Yeah.
contraindicated?
Ayurveda says that Navanam Lagu Samvatsaroshitam. Abhishand in the sense which has the more tendency to reduce the metabolic rate. So any food which is new, it will be rich in moisture, and it will be rich in anactus. Snehamsha, it will be more. But as it is 1 old, that moisture will be evaporated, and even the anactus snigdhata will be taken out. When snigdhata and this moisture is taken out, ultimately there will be reduction in the calorie value. And one thing, ma'am, so whenever you are taking the any grains, it they says that on Navam Dhanyam Abhishandam Lagu Samvatsaroshitam, 1 year old is indicated, but not 2 year old. If you go for 2 year old, then Tato Urdhva Nirrasam. So that will be a totally nutritional less. Law. That is the reason only 1 year old. And we being a doctors, we are supposed to guide the each and every students how to assess, each and every customer or a patient, how to assess which is new, which is older. Because if you go to purchase the older grains, these merchant will convince you that it is a old, but you should have the skill to assess whether it is a old grain or new grain. So we usually in our OPD we train each and every patient who are visiting to how to assess these things, because Ayurveda recommended lots of tools to assess these things. In simple basis, you can assess whether it is a old or new. Because if you don't do that one, even though if you advise good diet, but it is going to become a failure.
Absolutely, sir. Thank you. I think with this we come to the end of the today's session, and we thank all the speakers for taking out their valuable time, and all the participants to having joining us for today's session on the burning topic of obesity. I think everybody wants to remain fit, and so I think the takeaway home message would be, you need to set targeted goals, which should be able to be, you should be able to meet those goals. It shouldn't be those harsh ones. And as all the speakers said, that initially the assessment is required and it has to be tailor made. One diet does not fit all. I think everybody agrees to it. And what is required is low calorie and low fat diet, but according to the medical condition of the patient, is there a comorbidity attached to it or not? So what is required is deficient the food should be deficient in energy, adequate in other nutrients in terms of micronutrients. You need to provide bulk in terms of sufficient bulk in terms of fiber, easily to be followed, so that the person adheres to the diet for a longer time. It shouldn't be which is a monotonous, lot of variety, as all the speakers mentioned. Portion size is again very, very important. So I think it is customized and tailor-made, and it should be reasonable in cost, and as per the advice of the doctor or the dietitian or the Ayurveda. I think a comprehensive effort is required in terms of physical activity, in terms of diet, in terms of, I think from the medical point of view, it's a teamwork, and all the alternative therapies do help in curbing down the mortality or morbidity due to obesity. I thank you all. I would like to thank Dr. Umesh Kapil from the Epidemiology Foundation of India and International Epidemiologic Association, and our director, Sir Dr. Sanjeev Mishra, for always encouraging and guiding us through the series of this webinar. And we hope to see you next week with a new topic, which will be announced shortly in a day or two. Thank you all for sparing time. Enjoy your weekend and happy Navratras.
Thank you, Dr. Rashmi.
Thank you, ma'am. Wish you the same.
Thank you.